What if I told you, if you live in America, there's something you take every day and consider normal or healthy, and it's actually doing something dangerous inside your body without you feeling any kind of pain? What's even harder is that your kidneys won't tell you a thing. They won't, Hart. They won't give you any sign that something's gone wrong. The kidney suffers in silence, and unfortunately, by the time you know, it's already too late. I'm Dr. Osama Ibrahim, a specialist in kidney disease and hemodialysis. And today, I'm going to reveal 3 hidden toxins to you. At least one of them is in your home right now. Stay with me until the end of the video, because toxin number 1 is what scares me most about the patients I see in the clinic. Welcome. I'm so glad you're here with us. And today in this video, we're going to talk about a very important topic. That's why I'm here. With one piece of information today could protect your kidneys for the next 20 years. As we agreed, we have 3 toxins I've ranked from relatively dangerous to most dangerous. In the most silent among them, let's start with toxin number 3. The 3rd toxin on our list is the one that'll shock you because it's sold to you as healthy, even essential for your body. We're talking here about excess protein, whey protein powders, capsules, and the very high protein diets for the gym and sports that have become so widespread, but they've led to excessive consumption of the protein you need daily. And that's where the problem begins. When protein enters your body, your kidneys turn it into waste that must be eliminated, most notably urea and creatinine. Imagine a water treatment plant designed to handle 1 million liters a day, and you're sending it 3 million. What's going to happen? The filters will wear out, the pressure will rise, and the tiny channels will start to get damaged. That's exactly what excess protein does to your kidneys. It raises the pressure inside them until they wear off. As for nutritional supplements in general, that's a whole other story. Many of them aren't subject to strict regulation. Some contain heavy metals or compounds that directly harm the kidneys, creatine and fat-burning pills. And even these natural herbs, all of them can be a silent burden on your kidneys. So what's the solution? The solution is simple and practical. Your body needs 0.8 to 1 gram of protein per kilogram of your weight daily. If you work out a lot, you can reach 1.4 grams, but no more than that. And don't take any supplement without consulting your doctor, who should know your health history. And always remember, natural food is always safer and better, even if you need extra protein. Remember that your kidneys work in silence, so don't overload them. The second poison, and I bet it's on your desk right now. Of course, I'm talking about excess caffeine, especially energy drinks. Coffee itself in reasonable amounts isn't a big problem at all. But with excess caffeine, the story here is completely different. And that's what most people don't know. Caffeine acts as a vasoconstrictor. It narrows the blood vessels throughout your body, including those that feed your kidneys. Imagine a water hose when you press on it with your finger. The water decreases and the pressure increases behind the squeeze. That's exactly what excess caffeine does to your kidney arteries. It narrows, it pressures, and it reduces blood flow. But the biggest danger is energy drinks. These drinks don't just have caffeine, they contain taurine, and concentrated sugars. Altogether, they put a heavy load on your kidneys all at once. In recent years, we've seen in medical circles cases of acute kidney failure in young people in their 20s without them having any prior illness. And the common denominator among them was that they consume 3 to 4 energy drinks daily. What used to affect older people is now starting to knock on the door of the youth. So what's the solution, doctor? What do we do about caffeine? I can't not drink coffee. The solution is simple. Don't exceed 400 milligrams of caffeine a day. That's basically 3 to 4 cups of coffee daily. That's the maximum. And as we agreed, energy drinks are not ordinary drinks at all. So it's best that you avoid them completely. And if you feel like you can't avoid them or can't stop drinking them, that's a sign you need to pay attention to. Remember, the best gift you can give your kidneys is pure water, 2 to 3 liters a day. It protects them naturally and without any complication. Before we get to poison number 1, which is the most dangerous and silent of them all, if you feel this information is helpful, hit like now and tell me, if you drink energy drinks, how many cans do you consume a day? Number 1, we've reached the moment we've been waiting for. Poison number 1, the most dangerous, the silent, and the most widespread. And this, unfortunately, is what most doctors don't warn about enough. And I see it every day in my clinic. I'm talking about high uric acid in the blood, and that's because of our daily diet. Uric acid is a natural byproduct of digesting substances called purines, which are found in high amounts in red meat, liver, kidneys, and seafood in general. When uric acid levels rise in the blood, It starts to deposit in the joints of the hands and feet. It starts depositing in the joints and causes a disease called gout. In the kidneys and urinary tract, it forms stones that damage these tiny tubes, causing recurrent infections. And over time, through silent accumulation, it turns into chronic kidney disease without you feeling any pain at the beginning, and worries me more than anything else. Millions of people in America are living with dangerous levels of uric acid in their blood, and they don't feel a thing. And unfortunately, that's what most people don't know. You don't have to have gout to be at risk. High acid levels load are enough to quietly destroy your kidneys. And even more dangerous than all that is seafood. And most dangerous of all is artificial fructose, which is found in soft drinks and packaged fruit juices. So what is the solution? First, cut back on red meat. Once or twice a week is more than enough, and replace it with white meat like chicken. Stay completely away from fructose-sweetened drinks. If you find any product and read that it has a high fructose content, do not buy it. Thirdly, recent studies have proven that cherries, berries, and lemons, they help lower uric acid levels naturally. Fourth, and most importantly of all, at your next blood test or medical checkup, ask your doctor to do a uric acid because, unfortunately, most doctors don't include it in the routine tests done for you, the ones done for patients, and that is exactly the problem. Okay, let us review together what we have learned today. Poison number 3, excess protein and nutritional supplements. Excess protein in supplements? They strain your kidneys with extra filtering they do not need, and it increases pressure on the narrow filters in the kidneys. Poison number 2, caffeine and energy drinks. It constricts blood vessels and reduces the blood flow reaching the kidneys. Poison number 1, high uric acid levels. The silent enemy settles in secret, and it destroys the kidneys without you feeling a thing. The good news is that these 3 can be avoided with simple decisions starting from today. You don't need expensive drugs, equipment, or complex devices. It takes willpower. It just takes information and willpower. Before I go, I will give you one practical step. At your next blood test, ask your doctor to measure creatinine and uric acid and GFR, which is the glomerular filtration rate. 3 simple numbers can tell you a lot you don't know about your kidneys. Lastly, if this video helped you, or you know someone who needs it, send it to them now. And remember, we made this video for you today with the goal of helping you. I also hope you've done something good for someone else. And always make that a habit of yours. Like, share, and help others out. I'll see you next week to check in and reassure you. Take care and stay safe.